As a whole, when we look at behavior change, we acknowledge that each of us have individual beliefs and understandings. And if we don't pay attention to it, people may not be heard.
Hello, and welcome to the Whole Health Cure. One of the biggest struggles we all have is behavior change. Not just knowing what to do, but actually doing it. And not just doing it for a while, but continuing on a healthy path. I'm joined by Dr. Daniel Pino, who's a seasoned primary care physician from Eskenazi Health in Indianapolis, Indiana. Certified by the American Board of Internal Medicine, American Board of Pediatrics, and American Board of Lifestyle Medicine. He has a passion to focus on relationships as a foundation to behavior change, using his personal journey to connect and help others find a pathway to outcomes and well-being. Thank you for joining us.
Thanks for having me. It's good to be here.
Yeah, so I'm really intrigued by this topic and this focus on relationships as a pathway to behavior change. So I want to kind of start by asking you your own personal journey, like what led you to this being an area that you're interested about?
I think clearly when we talk about our story, right, it can be a long story and there's a lot of parts to it. And to think more specifically where it began in relationship to patient care and why I find myself in the programs that I do, it comes down to even my reason why I went into medicine, right? I think of each individual and myself, right, as, the journey that we get to walk into. And for me, I come from a family of physicians and it was something that I was geared to be. And we know ourselves and we know our families and who we are, but it did take me some time to find my reason, right? My meaning, my why. And I found it while I was in college. And I was working in an after-school program that helped take care of predominantly immigrant families in the north side of Austin. And I think that in that moment, what I desired was to be in community with people. And that's a reflection of both my upbringing, my being who I am, what I believe, but it was a connection that I realized that I wanted to be present in spaces that people needed others present. And when I was there, I was asking myself, what would I do? And what came up often was conflict or issues around healthcare. And so I had the background of understanding healthcare and already had a trajectory to be a doctor. And when I found that space where I decided that I wanted to be in community with folks and walk into the difficult parts of life, it was just naturally fitting with my desire to be a physician, right? And it sounds like my med school, I'm forgetting, but my paperwork that I submitted for med school, when it just comes to like, why do you want to go to this school or why do you want to go to residency? And the truth is it's there and it hasn't changed. And it's reflected in my current role because I was fortunate to find a space that I understood that and found it to completion, which is a journey into medicine where we give care as a unit and 2 units of people. And it really revolves around connecting and being in relationship in a way that is intentional. So there's a lot more to it. I'm going to pause because I feel like I've been talking a little bit more, but I don't know. I'm glad to keep doing more about my own space with that, but because I think that there's a lot more that I've found on that space and in the journey into that, which is what led me to Eskenazi and staying here in Indianapolis.
Yeah. And the relationship, that interaction between 2 people, like you said, there's so much there, right? What are key elements of the relationship? Like what makes it so foundational?
It's in part being known and then belonging, right? I think we all have that in us to as a part of who we are and how we identify. And if you look at a lot of different ways in which we structure even well-being, right? You can look at different models that look at meaning and accomplishment. And sometimes we first have to be aware of who we are first. And so that would be initially that thought process is to kind of connect in a way that is intentional, for it to be important for you to engage in conversations beyond, where am I currently and where do I want to go? if that makes sense.
Yeah, it's helpful because the relationships, I mean, there are so many types of relationships, and then some are really not health promoting, right? Some are create a lot of discord, a lot of tension, a lot of stress. So there are a lot of nuances to, using relationships as a foundation for behavior change. Um, can you talk more about, in your work, how it starts to play a role in how you help your patients?
No, for sure. And going to one thing you just said is that it is hard, right? I mean, relationships are hard, right? And the stress of it is in part of that journey and what we do. And I think if we can identify that and move into that, it's important to be aware of it and not give up when it becomes hard, right? Often in healthcare, right, we do a lot of, we're the answer, right? And so we've chopped it into a very quick conversation, and we actually don't leave space for the difficult parts of it at times when it's especially in a 15-minute visit. And I theoretically have all the answers, and it comes in the format of either advice or a pill. Um, and and so when we wanted to be more proactive and I say we because I'm talking about the programs that I get to work with, but speaking even just in a journey of a person, when I am in relationship, what I've learned over time is the more I'm able and willing to sit through the hard times is the more that we become connected in a way that's intentional, right? And I actually learn about myself more than I learn about the person I'm in a relationship with often. And as a whole, when we look at behavior change, we acknowledge that each of us have individual beliefs and understandings. And if we don't pay attention to it, people may not be heard. And I felt that way in my life, right? I felt that way as a person that thought I was helping a group of people in North Austin, right? There's something about it that was meaningful to me. But if I didn't first understand it and then also articulate it and have people walk with me in there, I may not have understood the fullness of why. And I feel like that's something we can bring to a patient care space.
When you say that, often you learn about yourself as you, you know, or in this process of that relationship. Can you give a specific example of how that has worked for you or when you've realized that?
Yeah. To give context, we at Eskenazi is where I work, and we have lifestyle group visits that we have with our patients, and we started with employees. And I tend to enjoy that space because I like facilitating, and it was fun for me to be able to give context of information. And one day I was talking about treating high cholesterol, and a lot of times it's only been a conversation with patients about medication, right? And in our groups, we've been talking about more than that, right? We've been talking about things like eating and exercise and sleep. And of course, we talk about medicines because it's relevant. And in that moment, there's a person in the group that had a question about why he needed to take this medicine. And with my doctor cap on, I gave the doctor answer, right? Because I felt obligated, right? And to a degree, I felt it was my duty to give the thing that I thought was most needed as if it were the answer that was available. And even in the context of this other big change that was happening, or this thought process on change. And I remember it was exactly that moment that I looked at his face, and what hit me is that I hadn't paid attention to what he was actually asking me in regards to why and why it was important. I instead was only hearing high cholesterol and how you manage it. And I looked around the room, and I immediately, as I put it, sometimes when I talk about this, is I sat on my doctor hands, right? And I just asked, tell me again why it's important, right? And he started talking a little bit more about his conflict with being at an age where there may be complications due to high cholesterol. And instead of even giving an answer towards that, I just turned to this group of people and I said, has anyone else ever felt that? Right? Is anyone else conflicted in this moment? And it began to just escalate in this beautiful conversation about how it's not always easy to be confronted with either our age or a reality of what's occurring in our bodies. And for me in that moment, like, going back to how something like that helps me reflect on my own behaviors, right? Because it's really about my behavior there. I had a belief that I had to give a certain answer. in a context of a conversation that would change someone's life so they could survive well, right? And the truth is, what I believed, although helpful, was not the truth, right? And it's actually not what I valued most. It's not even what I cared about most. What I cared about the most is these people in front of me and that I get to know them. But I was breathing and speaking a thought that was a belief that I didn't realize that I held strongly onto, because I believed that if I didn't, I wasn't a good doctor, right? And so that's what, like, and it is an example of something that I know we've already switched right into like clinical care, but that's something that I've learned even as I've journeyed in my own life, right? Even when I talk about when I was in college and I was engaging in those conversations with people in like school, like there's a reason why I do it. And it helps me to be aware of that reason why, so that when I'm in those spaces, I can be present, but I can also be healthy for myself so that I'm not trying to do something that I don't really want to do, even though it seems like I wouldn't do it anyhow, right? But we just trend to that at times.
When you answer questions like that as, Dr. Pino, this is the answer that you will get about cholesterol, versus Dan, the person who really wants to understand and kind of be more yourself in these interactions, do you find that, or how do people respond differently? How does the nature of the relationship kind of flip, or are they similar? How do you find that affects the relationship with the people you're talking to?
I feel like it opens a door, right? And it probably better is it brings down walls, right? I'm answering out of a wall that I've built, a room that I live in, right? I've structured this. And ultimately, I mean, it's vulnerability, right? I mean, we're kind of gazing around a conversation, which is, it's truly just about being vulnerable in a relationship. And so when I bring down what I think is true about myself in that moment, and I present as Dan, the person, and the story, and someone that also can feel the same way that the person in front of me does, there's an immediate withdrawal of even some folks' conceived impression of who I am. Now, it's not always that way. Not everyone wants it always, right? That's the part of relationship. You have to be at a place where it's either received and you feel safe talking about it. And I think we can, even in that, could be another conversation about how to approach that. But if I'm practicing my own awareness in that, I should be able to pick up on that. But the moments that I stop, when I sit on my doctor hands, the most, right, is the way I look at it, is the most when somebody, instead of being a doctor and a patient, I'm with another human that has a similar experience. And I feel that that allows for there to be a door open for more conversation, which I know you probably are with me, right? So as a primary care doctor, sometimes that can be daunting because we don't want it to, we feel like it'll go out of hand or it'll go longer than it needs to be. But the truth is, to me, it feels like it opens up a door to what's truly needed to being said. And then I can truly hear it. And then I can make decisions with people based on truth that's in front of us versus ideas of what we think is happening.
And probably you see the flip side, right? Patients may feel like they should be telling you that, they exercise 5 days a week and eat. And then when you are honest and kind of more just human to human, because we all have, times in our life where we are doing certain things well, we're not doing certain things well. Do you find that the nature of what people want to share with you changes?
I think so. And I think the nature of what I'm willing to share with them changes as well, right? I think that I can empathize and be compassionate and then be perspective on my own journey, right? And so it's a give and take, and, cautiously trying not to only make it about a conversation, but instead about the person that needs to go to a direction or is seeking some advice. Um, I often will try to pay attention to where, if I can tell my story with it, I'll tell it back or hear what they've said and say, here's what I know too, or be aware with them. But I think we start to hear, but I actually, the true answer is yes. I hear so many different things, right? I hear more about what's important to the person in front of me versus like what we're all thinking is the answer we were looking for, right? Like a different patient once, I was taking care of a guy that had so much trouble with his blood pressure control. And this seems pretty straightforward that anyone would say, of course that would happen. But I he wasn't taking his medicines, right? And I was working with a resident this day, and the resident came out, he's super flustered, and he was like, this guy's not going to take his blood pressure meds. I'm just going to add more medications. And I went in there, I said, well, did we ask what else is happening? And I led with just this context of, what are you looking for? Like, what is your goal for yourself today? Like, what is something that's important to you? And ultimately, like, it did matter to him, but what was more important was what was going on at home with regards to a son that was having difficulty. And I said, thank you for sharing. Do you need support? And he was just saying, no, thank you for listening. And I then just told him very quickly, here's some things that I know about blood pressure. Here's some things that I know about what you can do. Didn't say you had to, didn't say you must, didn't say I have an answer. I just said, this is what I know, right? But I think in the context of him sharing what was important to him, through that came out why blood pressure could be important to him, because he cared about being there for his son, right? And it connected without me even having to articulate it. It just was something he did. So the next time he came in, the resident came back and was like, I don't know what you told this guy, right? But he had started taking his medicines. He had started walking regularly on his own, and he changed what he was eating, and his blood pressure was under control, right? And I didn't do anything different, right? And he told me a little bit more about himself, but ultimately we just kind of sat in a space that was important.
That is really amazing. On so many levels, when I hear this, I think, the difference between patient-centered and system-centered care, right? So there's certain objectives that we hope that we can accomplish that are system-driven, i.e. get a certain number to a certain range, do a certain number of, preventive tests, et cetera. And then there's what's important to patients, and they're not always the same thing as what we may think is important. And that is such a beautiful example of, we're really, at the end of the day, there to serve people. And I think there's so many layers of complexity that have been built into the system where that fundamental piece is hard, harder than it should be. The other part to that, Dan, is you also mentioned, that truth is part of expressing who you are, as opposed to feeling like, Dr. Pino has to give a certain answer. Has that changed? Kind of whether it's the joy, whether it's the nature of the job or the work that you're doing, like how is that, or maybe just on yourself and not related to work, has that changed things for you?
I would say it's made me healthier in general. And I would, two specific areas, both as a doctor, but more importantly as a person. And I think I can relate them by sort of starting with the doctor conversation. And like you said, so in systems, right? And this is a belief I have, but it's also, I think, something that we're realizing and is being proven over and over, even in evidence-based practices, right? That is being true, right? The way in which we go to the metrics that need to be met matters, right? There may be one solution that we followed, but there's maybe multiple solutions we can go towards, right? And I, kind of like when I had to sit on my doctor hands, right? I say that as if like, I honestly, sometimes I go into rooms and I'm like, I motion below my legs. I'm like, I'm sitting on my doctor hands. But as a doctor, and it's relevant right now because we all feel this. We feel the strain and the burden of that reality of what comes with the need at times to meet metrics that we know are for people's lives to continue at a healthy place, right? It's not because someone's just telling us a metric, although it feels that way sometimes. It actually has tangible evidence behind people living long, healthy lives, right? The problem is in what I understand and how I was affected by this is if I believed I had to give a specific set of instructions or else someone may not be okay, the anxiety behind that is pretty high, right? The pressure behind it is very high. And it leads to the conversation being different in the visit that I have with that person. So as a doctor, I was living in an anxious world, right? Thinking that I had to. Whereas that was just one pathway. And when I opened up, the truth could be different, right? That maybe what's important to the patient is something I should focus on, and realize that as we allow the conversation to come out, the metrics will change, right? The metrics can change in that direction too. And And I felt like this weight of the world off my shoulders, right? I'm all of a sudden someone that has knowledge of an outcome, walking with someone that may not, or maybe does, and is struggling with it. And that's coaching, that's relationship. Now, what's hard is, like we talked about earlier, when someone's like, I hate it, or I'm not going to listen to you. How do we respond? Which is, what do we do in a relationship? It's hard. Um, so from a doctor's perspective, I felt like I can enter the conversations now at a happier place, because I don't have to be someone I'm not, and I don't have to be more than I think I can be. Right now, sometimes there's definitely time. I mean, every day there's times where I have to say, this is something that you need to do, right? Or it's really important. And it's because of these reasons. I want to explain what I know just so you know it. And if you're not doing it, I'm going to tell you my honest opinion, which is it's not to your benefit not to, right? Um, and that just, but it's a freeing space. So as a doctor, it was healthy. The opposite end of that is, as a person, it made me need to then reconcile what I've been doing in my life, right? How do I practice the same thing I'm talking to people about, right? How do I keep on a journey that's been for me? And for me, that, I told the reason why for me, in part was because of community, and it really is at the depth of my heart. But in part, it's because I am a journey myself. I'm a work in progress. I have my own health risks, right? And when I actually started my journey into being a doctor, right, my first year of med school, right, I come from a very unhealthy place of being. I'm from Texas, right? And I don't mean that for anyone, I don't mean that negatively, but my eating habits growing up were were not what I am now, but it's because I grew up and I also grew up in the world where fast food was every day, right? I grew up in the world where, I drank soda every day, right? I grew up in the world that, I didn't think about all these things like I'm talking about now. And so my first year med school, my journey is my dad passed away from a heart attack, right? And I had many things come up in the moment of that were hard, and my body was not healthy. It was good, but it wasn't healthy. And so conflicted with that, but then beautifully surrounded by people that could help me see differences in what I was doing, and also just being exposed to different things like healthy food, right? It helped me just see where it was important to me. And so like that was a why that was already at the background of this. And as I let myself not have to be something I'm not, as I was journeying through that, right, it made it just much more relevant to why I could speak about my own needs and what I'm working on. And right now, right? So like even today, whenever I have a patient in front of me, right, I can bring me and I can tell them like, hey, guess what? I also struggle with this. Here's something I know. And here's how I approach it.
For people who want to maybe break down their own walls, have that vulnerability, be able to speak their own truth. But I think, for some people, it's for all of us, really, it's almost easier sometimes to kind of hide behind facts, figures, kind of there's always different layers to any story. And sometimes it's easier to kind of have a slight distance, if you will, from what you're willing to share in any kind of relationship. How can people work on or improve their ability to kind of speak their own truth, understand that awareness, first of all, and then vocalize it? It's a really hard thing to do.
You're right. It is very difficult. And it's first acknowledging that your story is important, right? And if you don't know that, then it's something that you can practice, right? I mean, this is where things like even just writing down, what you value. And if you're not sure what that even means, just asking yourself, how do I react in certain situations, right? Or who am I trying to engage in conversation with that really fills my heart, right? Because I think that those are things that first have to be, practicing awareness, I feel like is something that has been really revelationary to me in the last several years in the current space that I'm at, because I still don't practice all these things well. And it's because I'm not sure if I fully know myself or I'm okay with it. And so, if I were to say back to when I was more concerned about not revealing too much or even practicing relationships, I don't know if I knew what I valued and was aware of my own hopes and desires as much. And so if I practices would be more awareness practices and finding ways to be able to write down things that I'm important for me. And if I'm not sure, explore some conversations about that. Because I think that once I was able to open that door and say, hey, what I care about matters and how I articulate it matters and it's not harmful, right? It is actually helpful and it's maybe worthwhile. Now, not in every situation, right? I think that's hard. Um, but I think that's a place that I would begin would be just more awareness of of asking why am I here and what's important to me? And then paying attention to in your body where you sense the frustrations that come up or at least barriers that you may not be aware of, right? So for instance, when I was telling the gentleman about cholesterol medications, like I I knew in my body that I was doing something that I typically practice because it felt like it's hard to explain, but I feel that tension in my back, right? I feel this like obligation and then it goes up my head here and I can sense this obligation. And, you can call it something, but if, at the moment I wasn't quite aware, but now I'm pretty keen on it whenever I start to get in conversations where I'm doing something that I feel obligated to, I just have to, I've learned to now pause and say, where's that coming from? And so I feel like at a beginning state, you can ask yourself, what do I feel? And acknowledge those feelings there. And if you don't feel safe, then that's not a bad thing. It's just something you're there. And I feel like in the beginning processes of relationship, right? There's a lot of contextual things that matter, right? Because sometimes you're not really safe in conversation and you shouldn't force yourself out of that. You shouldn't say, I have to, but you should understand maybe why it's there. And ways to do that are understanding who you are, what's important to you, and what's present in your current, your body when you feel that.
Hmm. And outside, doctor, patient, just bigger umbrella of relationships and behavior change. So, we all struggle with, do we eat the right things? Do we exercise? Do we sleep enough? All these behaviors that we know promote health. In the context of people's lives, how can they create relationships that can support the types of behaviors that I think we all want?
Fortunately, a lot of us have people around us that can support whatever we're doing. And then, I say that cautiously because I know that there are individuals out there that don't have that and that I don't want to disengage from that. Like there may be an emptiness there. And in that you can seek out individuals that you either acknowledge are positive influencers you feel different around and ask if they might participate with you in understanding where you're trying to go. Um, Programs that are available, right? And I think that one of the beautiful things, I think healthcare offers a great place for understanding our health. I think I have an optimistic view of the goal that we generally have at the depth of what we're trying to do. I think that there's maybe a lot of things that could change about that. And I know that we don't have the hours it would take to go down that. But ultimately, if someone's wanting to understand their health, having a place that you can acknowledge with a provider like myself or like you and just talk about it. When you enter a conversation like that, you can actually enter it with the expectation. Say, hey, I would love to know how I might be able to articulate what I need in my life to be able to journey towards that. And then understanding if that's a desire you have to be in behavior change or to understand changes that'll affect your health, it's absolutely okay to acknowledge that and speak it when you get into that conversation. When it comes to relationships outside of like a healthcare system, though, being aware of like the idea that it's okay to tell people that are close to you, whether, the people that most affect us are often our friends, right? And our social groups, our work colleagues. And, and if you feel like you can test the waters by just asking a question um, the hard part that is the first attempt to speak the truth is often the one that once it's accomplished opens up the doors to more. And so if you're willing to just say, hey, this is something I'm thinking about, or it's become important to me to journey into better health. Is that something that's important to you? And you can test the waters that way first. And maybe then you've connected with one person that might say, yeah, it is. And you can reveal what you might want to try to do next with it.
Mhm. And how have you taken that and used that in the programs and the work that you're doing at Eskenazi?
I think it's been the center of what we're doing. And to try to explain it, so and if it's okay, I'm going to give context here so that not only I know what I know about our programs, but so I work at a really amazing public safety health system. And essentially, we're the safety net for those that are marginalized in Indianapolis. It's called Eskenazi Health. And we have been around for generations, right? We've been working since the smallpox pandemic way back when. And the goal has been to reach out into communities that need service. And we have a large group of people that work for us. And then we also have people that we serve, a very large population, mostly those uninsured, mostly those marginalized. And when we were first thinking about even like this type of care in the program, it actually wasn't a new concept to us because we are federally qualified health centers. So we get a lot more wraparound perspective on when a patient walks in the door. We want to make sure we're paying attention to, do you need social services? Do you need mental health services, and connecting them immediately? But our programs had actually also been in place for about 10 years where we had dietitians on site. And we even have had health coaches in our clinics for years. And it had been more of a referral process. And so when we started conceptualizing bringing that more tangibly to the field of what we do, and whether it was in groups, we were already doing some sort of groups, and actually helped set the stage for national programs like diabetes prevention program. If the context was there, and so and I would say that actually the entirety of our network is based on relationship, because it was about being connected to a city that was needing to understand health. And so we started then bringing it closer to the primary care team or a provider like myself in a way that could be replicated in the entire structure. And so right now what we offer is both group and individual group appointments throughout the clinics in the sites, as well as individual appointments with dietitians and health coaches. However, the beginning place that we started was we wanted to say, how about ourselves? Like, can we be patient number one? So we also began with an employee clinic, and by encapsulating all of it, we started that conversation internally and have begun to replicate it. And so when you're I'm sorry, I got distracted telling you what I do, but the reason why it matters is because the way that we've structured it for clinical care is having intentional touch points at every level, right? So when you're in my appointment as a provider, how do we help make sure that our providers are able to listen and understand, or have context around getting them connected to people that might be able to walk through behavior change, so that when somebody initially gives that truth, like, hey, this is important to me, it's not just empty handed, right? It's oh, well, we have someone that you can connect to, or I have the ability to at least begin the conversation with you. And then if you need more support or desire more context of relationship, that can be through a dietitian, that can be through a health coach. But where it's really beautifully done is in group settings, right? So we have these groups of people that are walking through diagnoses, right? Whether it be diabetes, high blood pressure, or just hopeful for preventing diabetes. And you get into a setting of individuals that go to the same clinic that you go to, live in the same neighborhood that you live in. You may not know them. Some people know each other. And you just start talking about it, right? We offer information, but we're really just talking about it. And we're talking about what's relevant to people. And so that's what we've kind of been able to see really change behavior. In addition to then asking, what are some things you're wanting to work on, right? Like, let's understand, more importantly, like, where you wanted a journey, so that we can be aware of it with you. But the context for our organization has been, how do we present our conversation so that people can be heard? And then when they have something that's important, how do we connect them to the right resource? And then as we develop more trust, as we develop more desires, as we develop more perspectives, we'll bring more people to the conversation. It actually brings it further away from the physician, because I'm no longer the needed part. But the reasons why providers are important is because we can still continue to have that relationship that can matter towards a longer goal. And so when it comes back to me, I don't disengage from the conversation. I just continue it.
Yeah, that's such a critical part, especially with the trust, which is also really critical. Well, Dan, I want to thank you for everything you've shared. Is there anything you want to add that we haven't had a chance to talk about?
No, I think we've covered a lot. I just appreciate even this conversation, because I feel like even as I've been answering, right, I've found myself reflecting and revealing things that I hadn't really thought about more intentionally recently. And And I think that's the main thing I would say is my ending statement. If I were going to end here, would be to say that it is a process, it is a journey, and we're all on it, right? And even if I'm the doctor with that hat on, right? I'm still a human and I still have my own thoughts. I have my own uh, beliefs and I have my own important factors that matter. And the more that I'm able to acknowledge that the person in front of me, like yourself right now, is someone that's also on a journey, then I can be really intentional, not only about hearing you. I know I've talked mostly here, but like being aware of where you're at, but then how that reflects on where I'm at, no matter what, is always going to change something new about me. And if I can pay attention to that, it's really going to make me not only a healthier person, it's going to make me feel more valued as well. So,
Yeah, no, I completely agree. And I've learned to sit on my doctor hands a little bit more too. So, so thank you so much. Thanks for everything you shared and all the great work I know you're doing at Eskenazi. I think, you really are doing that hard work of really fundamentally trying to change a healthcare system into one that helps people reach their goals. And I think it's a very hard task to do because I think you're on the front line of making that type of change happen. So thank you for all the work that you're doing.
thanks. Well, I appreciate that. And I feel fortunate because I really think that we have a unique culture that allows for this to happen well. But the good news is it can be anywhere. And so I'm excited about the work you're doing as well at Emory and all the cool things that happen there.
Well, thank you so much.